Everyone knows that medicine with its procedures and medications gets better with research, but few people understand that research is not enough. Research needs to be followed with program evaluation. Program evaluation is the follow-up of persons who are given a medicine or procedure by a regular health provider. It is a means of determining the effectiveness of a medical treatment in the real world. Yes, you still want to see your doctor to report your progress and any side effects. However, an accurate assessment of a medication or procedure relies on the responses of numerous cases from many doctors using a standardized procedure. Research is valuable, but there are several problems that go with it. One is the placebo effect, such as the Hawthorne effect. Whatever you do, people respond and improve. There's a researcher bias. Pharmaceutical companies do most of their own research or use a trusted researcher, as entrusted to want more money for the next project. Research journals favor positive results. Regression to the mean simply means that chance and variable factors influence every study. A large effect is likely to be smaller in replication. Psychologists tried to replicate 100 studies. Only 36% were in line with the original findings. Looking at 8 major psychological journals, researchers found half the papers with at least one probability value in error. Sometimes the promoters of a new drug will explain how it works. Unless you have a PhD, you should assume this is advertising. When several studies show positive results, we call that evidence-based treatment. Certainly several studies are better than one, but do you know if the researchers are familiar with each other? Do you know their source of funding? Here's some additional reasons to be wary of evidence-based treatment. Do they have a legitimate control group? Fortunately, most drug studies use a double-blind method, although you might meet a placebo that produces a physical effect. Sometimes the evidence is based on too few studies, and sometimes just a small improvement is found. But remember, saying a drug is effective only means it works better than chance. Now, if a small percentage of a group makes significant gains, they will say that the treatment works. Treatment being tested might not be well defined. The kind of people who do research might be more highly trained than the regular providers who will later be using this drug or procedure. Studies don't always use the same criteria for improvement. People who are being studied may act differently. What works in the short run might not work in the long run. And because research is expensive, it's difficult to run a study where you vary both times and the amount of the medication. The biggest reason not to trust research is that they're funded by people who want to see positive results, which brings me to my first recommendation. The United States government should replicate exactly studies that show promise. These duplicate studies should be done by persons with nothing at stake in the results. Chances are the replication will be less promising than the original study. Program evaluation is done on persons who have received actual medications or treatments. I have done program evaluation for a state psychiatric hospital, a 3-county correctional program, and numerous educational programs. At the psychiatric hospital where I worked, we sent out a questionnaire called the Patient Adjustment and Role Skills that measured depression, confusion, anxiety, drug use, employment, and so forth. Which brings me to recommendation 2. Standardized methods or measures should be used for program evaluation. Now with our questionnaire, we also repeated it 3 months and 6 months after they left the hospital. Upon entering the hospital, 82% responded to our questionnaire. 6 months later, that dropped to 42%, which brings me to recommendation 3. Follow-up should be based on random samples, not the entire population. Persons in the study should be hunted down until you can get a response rate of over 90%. Non-responders include persons who have died or in treatment elsewhere. Consequently, you cannot make a valid judgment if too many of the subjects cannot be found. The effectiveness of different treatments and medications vary over time. It would be useless to do a follow-up on a flu medication 1 year later. By that time, even subjects who took no medication would be well. On the other hand, the treatment for drug addicts might do well in 3 months, but look like a failure 1 year later, which brings me to recommendation 4. Initial follow-up of a medication or procedure should occur at several points in time. Once the critical points in time are determined, future follow-ups might be reduced to as few as 1 time. When I was chairman of a research committee, we did a special study where pairs of psychologists rated incoming psychiatric patients and later visited them at their homes in the community for a second follow-up rating. With in-home ratings, we found improvements to be minimal, with over half of the former patients looking the same. However, according to the survey we did with significant others, they said 93% of our psychiatrics showed improvement. Which brings me to the most important of my recommendations for program evaluation. Program evaluation requires face-to-face visits, preferably in their homes. People are more honest at home. You can also assure confidentiality by letting them know you're going to report averages, not individual data. With face-to-face interviews, you can ask additional questions that might clarify the information you're looking for. You can also observe the person's body language and look at the surroundings for clues as to, is the house clean? Are the people well groomed? Best of all, you can often get the opinions of others who live with them. This is known as consensual validation. Doctors still need to do follow-up on their own patients. I recommend that the nurse ask for feedback before the patient sees the physician. It is my opinion that the doctor title gets in the way of a patient being completely honest. Patients typically want to praise the doctor for what has been done for them, and they don't want to appear negative. See, doctor is a time to get rid of the title on YouTube. I believe the American Medical Association should do program evaluation on new medicines and procedures on a routine basis. They could publish the results in their own journal or even have a website that would display the results. As previously mentioned, I recommend that this data be collected on home visits by trained personnel using standardized measures. In other words, physicians should not be the ones collecting this data. For alcohol and drug abuse, I believe the state should routinely do program evaluation on samples of persons treated in a private or public facility. I believe that state agencies responsible for licensing counselors should do standardized follow-up on samples of their clients. They could also create a website for persons who had received counseling to rate their experience. The current online questionnaires for rating physicians seldom apply to counselors. So who do you trust regarding new medicines and procedures? Drug reps who come with free samples and free lunches? Research sponsored primarily by the pharmaceutical industry? Or the anonymous responses of persons followed up who were given a medication or procedure? I think you know my choice.